my name is Lindsay Hoops, and I am going to be doing an abdominal and musculoskeletal assessment. Okay, finish washing my hands. Hi, my name is Lindsay, and I'm going to be doing an abdominal and musculoskeletal assessment on you today. Are you having any pain anywhere?
No.
Okay, we're going to start with your abdominal assessment. If you can go ahead and lay back. All right, the first thing I'm going to do is I'm inspecting your stomach for any scars, striae, which I'm not seeing any. It's symmetric, there's no obvious masses, and no abdominal distension or spider veins. And the first thing we're going to do is auscultate or listen in each 4 quadrants. I am hearing high-pitched rumbling in the small intestine and stomach area, and lower-pitched grumbling in the colon area. And normally I would do it for 2 to 5 minutes. All right, and then the next thing we're going to do is we're going to listen for any murmurs over your arteries. The first is the aorta, right and left renal artery, and the right and left iliac artery. And I did not hear any murmurs. The next thing I'm going to do is I'm going to do some percussion. All right, perfect. I heard dullness over the liver and the spleen, and then it was tympanic over the stomach and small intestine. All right, and then now I'm going to be doing some light palpation. Let me know if you feel any pain. Any pain?
No.
All right, I didn't feel any rigidity or any masses. And then next I'm going to do some deeper palpation. Take a nice deep breath in and out. All right, any pain?
No.
All right, I did not feel any rigidity or any masses. All right, and so the next thing we're going to do is we are going to test your musculoskeletal system. If you can go ahead and stand up for me, and I'm going to have you walk back and forth right here. I see even, equal movement, well coordinated, and no limps. Next we're going to do the Romberg test, which is going to have you put your feet together and then close your eyes. I would normally make them stand for 1 minute and observe if you were going to fall, which you're not. So you have a negative Romberg test, which is normal. And then next time I have you sit down, and I'm going to test your sensation. And let me know if you feel sharp or dull.
Dull. Dull. Sharp. Sharp. Dull. Dull. Sharp. Sharp. Dull. Dull.
All right, perfect. All right, and then next we're going to be testing range of motion. We're going to start with your neck. I'm going to have you look down to the floor and then up at the ceiling. Okay, and then side to side. All right, and then I'm going to have you touch your ear to your shoulder, both sides. All right, any pain?
Nope.
Oh, awesome. Okay, and then I'm going to have you stand up, and we're going to assess the range of motion of your shoulder. Okay, extend your arms out. Perfect. Any pain?
Nope.
All right, I'm not concerned with any rotator cuff impingement. All right, go ahead and lay them down. And we're going to test your abduction, and then to the sides and up above your head. All right, any pain?
Nope.
Nope, that was a good 180 degrees. Put them down. And then I'm going to have you go to the other side, opposite side. Right? And that was adduction, and that was a good 135. So good. Okay, so the next thing that we're going to do is I'm going to have you flex and then put your hands behind your back. All right, so that is internal rotation. That was good, 90 degrees, and then behind your back. Okay, any pain?
Nope.
All right, and then drag your thumbs up your spine. You reach about T7, which is good, and then about 90 degrees. Awesome. Turn toward me. All right, and now I'm gonna have you put your hands like this. Okay, and then I'm going to have you flex your elbows like that. Okay, that's good flexion, about 135, and then down to the ground. Okay, and that is good extension, about 180. That's good. All right, and now flex your elbows like this. I'm going to test for your pronation and supination. Okay, like that, and then over. All right, perfect. All right, so that was a good 90 degrees, and that is normal. All right, so the next thing that we're going to do is test your wrists. If you can hold them out like this, and then flexion and extension. All right, that was a good 90 degrees for flexion and a good 70 degrees for extension. All right, and then now we're gonna test your hips. So go ahead and lay down on the floor since I don't have an exam table. All right. All right, the first thing I'm gonna have you do is with your leg extended, lift them up. Time. All right. All right, that's good. Flexion, 90 degrees, and now with your knees bent, do the same thing as far as you can go. Right. All right, that was a good 135. That was good range of motion. And now we're going to test internal and external rotation. So I'm gonna have you flex your knee. Okay, and then internal rotation. Okay, good 30 degrees, and then external, good 45 degrees. Other leg. Okay, internal, good 20 degrees. External, good 45 degrees. Perfect. All right, and then next thing I'm gonna have you do is I'm gonna have you flex your knee and slide your heels up to your butt. Okay, good. And then next one. All right, and that's touching your knees. That is good 90 degrees. And then I'm gonna have you press your back of your knees down to the floor. The heels came up, that's great. That's good range of motion to 180 degrees. Good, and that was good extension. All right, go ahead and stand up. I'm gonna have you sit on this chair. All right, testing your ankles. I'm gonna test for flexion, or plantar flexion and dorsiflexion. So I'm gonna have you put your flex your foot down. That's plantar flexion. That was a good 45 degrees, and then dorsal flexion up. All right, good 20 degrees. Okay, and then next thing I'm gonna do is check your spine. So go ahead and stand up for me. All right, and then I'm gonna have you bend over and touch your toes. I'm checking your spine. Looks even. Any pain?
Nope.
All right, perfect. All right, good 90 degrees and up, and then extend back. That's a good 30 degrees, and then lateral flexion. Go to your right and try and touch your calf. All right, that's a good 30 degrees, and then the other calf. That's good 30 degrees. And that concludes our assessment.